Hi guys, this is Dr. Michael Schneider from Village Pointe Oral Surgery, and we're just going to do a quick tutorial about how to irrigate after wisdom teeth extractions. Typically, your surgery will be considered day 0, and you're going to start irrigating on day 3. It should be listed on your post-op instructions as well. Nicole has graciously volunteered for us to irrigate her extraction sites. So she's had the surgery done approximately 5 to 6 days ago, so that area is starting to close up. Very normal, and what to expect afterwards or during the irrigation. A little bit of pain, there can be a little bit of bleeding from the area, plus you should get quite a bit of food and debris also out of that area. If it's been a few days since you've irrigated, you can get kind of an unusual smell in that area. That's very, very normal. What you want to look for if you're worried about an infection is actually getting swelling in that area. Typically with an infection, you'll get more swelling. That area will start getting hard, and there also may be some drainage as well. As long as the swelling is nice and soft, it's not very hard or anything else, that's typically pretty normal. So we're gonna go ahead and start the irrigation and show you, depending on your extraction sites, depending on your anatomy, the tissue may be positioned a little bit differently, so sometimes you may have to come to the irrigation site from the outside of the extraction area, sometimes from the inside, and I'll kind of show you the different ways. Hi guys, so we're going to go ahead and proceed with the irrigation of Nicole's extraction site. So she is, like I mentioned before, about 5 to 6 days out. You can see kind of a little bit of redness. Her suture has dissolved, so it's completely missing. And for you, it may be easier to position the syringe coming from the inside and kind of, actually position it into the extraction site. So you should be able to see how this syringe actually just goes right into the extraction site. You may have to play around. It may be easier to come from the outside and have it go into the extraction site this way. One way is not more correct than the other, just whichever way is easier for you. And once it's positioned in the extraction site, you want to go ahead and gently rinse. And as you can see, you'll get a little food, a little bit of blood from there, which is very, very normal. And you just want to gently flush that out, and you want to repeat that about 2 to 3 times. You want to do that in the morning and at night in the beginning, and then kind of as the area progresses and heals, just go to once a day and eventually just stop.